Hi, this is Elvira, and I'm Clinical Application Coordinator for Phoenix area. And in this presentation, we're going to go over clinical reminder overview. Our learning objectives will be to understand the basic functionality of clinical reminders. We're going to explore the possible applications of clinical reminders for optimizing patient care. What is clinical reminders? The clinical reminder system allows caregivers to track and improve preventive health care and disease treatments for patients to ensure that timely clinical interventions are initiated. Example, clinical reminders are basically chart reviews that tells you what a patient really needs. They are visible in 4 places in EHR. You got the alarm clock, and it's the icon on the toolbar, and you see it right there, this little icon. And this is going to display what's due to that patient. The clinical list on cover sheet. This cover sheet displays the reminders due for that patient. Then you have the reminder drawers on the note tab. The report tab, this is going to require some configuration, and the reminders 2.0, you can task this by hospital location clinics. Details are available by right-clicking on a reminder. Clinical Reminder Dialog is going to facilitate documentation because it looks like templates. It also resolves the reminders. It enters information in EHR as well as in PCC. It creates a note. It does it all at the same time. It generates an order for meds, lab, or consults, and it does support treatment algorithms. So here's an example of a dialog for mammogram. Why do we need a reminder system? Well, it improves preventive healthcare tracking. It improves disease treatment for monitoring. It assists in clinical guideline implementation. It's going to improve patient safety. It improves capture of GIPRA and other reporting measures. It can be used to help improve local clinical standards. For example, if you have a policy that every diabetic patient needs to have a foot inspection on every visit, you can create a reminder to look for that. Clinical Reminders is a visible reminder system. It is a streamlined documentation tool. Clinical Reminders additionally delivers local configurable tools to solve local problems. It's a report tool that will extract real-time data based on specific reminders. The types of clinical reminders that we have the national reminders, which are delivered to all sites. It's going to be based on the same logic as health maintenance reminders, and all have associated dialogues for data entry and note generation. And you cannot edit these clinical reminders. If you need to change the clinical reminder, then you're going to need to create a local reminder. So you're going to copy the national one into a local reminders, and then you can edit whatever you need to edit locally. Caution should be placed that when you edit a national reminder, you don't want to make it less stringent, because the national reminders have been vetted, and a panel of experts have created the logic behind this reminder using standards of care. You may want to make it more stringent. So instead, for example, instead of doing maybe height and weight once a year, maybe you want to create the reminder that you want the height to be done every 6 months instead of every year. So you actually make it more stringent than the national reminder. You do not want to make it less stringent. Local reminders are reminders written at a local site to solve a particular clinical problem. Can be shared between sites, and dialogue can also be shared. Reminder reports can quickly extract data by provider and hospital location. It can be batch printed, and it's very helpful for local reminders in identifying and tracking site-specific issues. A finding is a piece of information that the reminder searches for in the RPMS system to satisfy who needs an intervention, that's the cohort logic, and what resolves a reminder. Findings include individual or group of labs, patient education topics, taxonomy of codes, which are your ICD-10, your HCPCS, your procedure codes, your CPT, etc. exam, vital measurements, or health factors. And there's other findings available for you to create your resolution logic. So this is a list of the resolution logic that you can use. And you can even create a resolution logic looking at a hospital location. The reminder will look to see if it is applicable for that patient. The cohort logic is who needs the intervention, so it's usually what turns it on. A reminder is applicable to a patient if they are in the cohort. In the example here, I have 50-year-olds with no history of cancer. So it's going to be applicable for any patient that's over 50 and has no history of cancer. What turns it off? So that's the resolution logic. It could be the diabetes, A1C, it could be a lab test, it could be some drug like the DMACE inhibitor is looking for current or fill prescription for ACE or ARBs. A reminder is considered resolved if the intervention, which is the finding, is defined in the reminder has been met or found. For example, in this reminder, the cohort logic is the HIV screening is due for any patient once in a lifetime between the ages of 13 and 64 years old. You have an expansion of that logic in the reminder due field, and it tells you right there the patient is 13 to 64 years old and no problem or diagnosis with HIV ever, and no HIV screening has been done ever. It's looking at PCC health maintenance reminder logic. So you have to look at what's set up there, and we're going to go into more in depth in how to look into the logic of the health maintenance to resolve your reminder or to turn on your reminder. And then it's going to find the lab. So the resolution logic here is that HIV screen, and you put in your local test has to be there, and it's the anatomical test. So that one test, no panels, that is used to resolve that reminder needs to be put into that resolution logic. So reminders due is for a patient if they are in a cohort, so it's applicable to them, so it turns it on, and have not yet had the intervention, which is the finding. So it's going to look for that finding. So here's the basic reminder logic. So first, it's going to look and see, does the patient meet the cohort criteria? If it's no, the alarm clock will not turn on. It will be white because it's not applicable. If it's yes, then it's going to look for any exclusion. For example, like HIV, the exclusion is there's no history of HIV. If there's a history of HIV, and if it's yes, it will make it not applicable in that case. So if they have the HIV disease, then we don't really want to order another HIV test. So it's going to be not applicable. So now let's look and see, did it get resolved? Did this patient have the HIV done? Okay. If the answer is they had it done, then it's going to be resolved because it found the HIV test, and it's going to turn the alarm clock blue, which means it was applicable, but it was done. If it finds that it wasn't done, so the HIV test was not done on this patient, it's going to be red because it's going to be due. So logic is based on standards of PCC health maintenance reminders. It's also going to look at best practice prompts. It uses national guidelines and standards of care that have reviewed these standards and help create the logic behind your reminders. And it also looks at immunization guidelines. GIPRA guidelines and other clinical indicators should be used to determine which reminder to implement at your site. So here are some of the enhancements that came with 2.0. We can create location list management. New reminder finding that allows you to define findings of location. When the reminder is evaluated, the finding will be true if the patient had a visit at one of the locations in the list in a specified date range. You got reminder patient list, and this one contains an option for creating a term-based list rule that can be used on both extract processing, which is not used in IHS. We do not extract this information through HL7 messages. Or you can create patient list creation, which is, it will create a patient list in the OERR team list file, and it's going to contain those patients from the logic behind the reminder. There's another menu option which we do not use in IHS, which is the reminder extract management. This one contains an option that allows display and editing of extracted parameters to use in the processing. We don't really use that menu option, but I can see the potential of using the location list management and the reminder patient list management to create logic and resolution logic. Then we have the reminder edit history. It's going to allow you to display a reminder definition edit history. The edit history was part of the reminder definition inquiry, but this was removed and now it's available in the menu option. The next enhancement is review date report. This review date report may be run for the following files. You can run it for computer findings, reminder definition, reminder dialogues, reminder taxonomies. A cutoff date may be entered, and all review dates prior and equal to that date in the file is going to be selected for the report. There are some other menu options that we do not use in IHS, and they're listed below. The dialog report is going to allow you to display a reminder definition edit history. So you have the reminder dialog element orphan report. This report will list all dialog sub-items that are not attached to a parent item. The empty reminder dialog report. This report will list all reminder dialogues that do not have any items attached to them. You want to check all active reminder dialogues for invalid items. This option screens all active reminder dialogues for invalid items. And then you can check reminder dialog for invalid items. And this option runs a routine that checks select a reminder dialog for invalid sub-dialogues, invalid findings, invalid TIU objects, or an invalid TIU field, template field. Clinical reminder parameter file contains the mailman group that will receive an alert for any errors related to clinical reminders. Typically, the mail group within that parameter is PXRM errors. PACs need to make sure that they are assigned to that group. So here's an example of a fileman parameter, and right there where it says reminder management mail group, there's where you're going to put your mailman group. So checking the mail group assignment, you're going to make sure that you are a member of the PXRN error group. You go into T-Box and you display user characters. And this is an example of the report. If you're a member there, whenever there's a reminder that has an error, you will receive a mailman message similar to what you see here that's going to contain the internal entry number of the reminder definition. It's going to contain the DUZ, which is the internal entry number of the user. And it's also going to contain the internal entry number of the patient. There's a lot more information that sometimes you will get in these reports. You can create reminders that can be locally created and used for both problem identification and intervention. Dialog can be used to resolve reminders. Dialog can stand alone and be used as documentation, just like a PCC Plus form used to be used in the past. And reminder dialog can be shared between sites. This concludes our presentation on clinical reminder. If you have any questions, please contact your area CAC for further information or your local CAC. And I hope it was helpful, and thank you for watching. Bye now.